Welcome to the Health System CIO show. I'm your host, founder, and editor, Anthony Guerra. On today's episode, I'll be speaking with Dr. Jim Blum, Chief Health Information Officer with the University of Iowa Healthcare. Dr. Blum, thanks for joining me today.
Oh, Anthony, it's a pleasure to be here. Thanks for the invitation.
You got it. You want to start off by telling us a little bit about your organization and your role?
Sure. So University of Iowa Healthcare is a $4.5 billion academic medical health system in Iowa, the only academic health system in Iowa. We consist of a sort of flagship 863-bed quaternary care center in Iowa City, which is in eastern central Iowa. We also have a community hospital that recently joined us a couple of years ago in Iowa City as well. It's across town. It's 100 beds, offering pretty much routine community care.
Mm-hmm.
And then we've also built a orthopedics hospital and office center about 3 miles away that includes an emergency department as well. So we're all centered here kind of in the Iowa City general vicinity. Calling it the metro area might be a bit of a stretch. But really our mission is to provide quaternary care and referral care to the state of Iowa. And so when you look at us, we actually have clinics in almost every one of 99 counties throughout the state of Iowa. Some of those clinics may operate one day a week or one day a month, but we provide services really throughout the state. And we are very proud of the fact that we provide that high level, high quality care that really can't be provided anywhere else in the state of Iowa. My job here is being the lead physician in our IT infrastructure, and really charged with finding new clinical technologies that come into the health system to help improve the care we deliver, in addition to looking at ways we can optimize the care we deliver using technology, and partnering across our IT environment and across the health system with others to help drive advances in care as we find them, and trying to make us a leading health center in the use of digital technologies in the way we provide care.
Excellent. Very good. So your title is Chief Health Information Officer, sort of is, we've seen Chief Medical Information Officer for a long time. Sometimes they switch out the word information with informatics. In your mind, is there a difference between a CHIO and a CMIO, or is it the same thing by another title?
Yeah, so depending on the organization you're in, I think it's different. We very deliberately created this role as a separate with an expanded role. Typically, your chief medical information officer is only charged with representing the medical practice, optimizing things for physicians.
Mm-hmm.
We really wanted this role. I have a role in our research enterprise, trying to optimize the way we do research, working with our population health teams, being respectful of the needs of everyone in the organization, not just our provider base, and how can we find solutions that enable those things. And then doing things like how can we optimize revenue cycle as well, things that a lot of times your CMIO just isn't really consumed with. And so I have my fingers, I would say, in almost anything that's digital that touches a patient, a provider, or our research enterprise. And so it's a bit of an expanded role, and we wanted people to be focusing not just on how do I deliver healthcare and how do I deliver medical care, but how do we actually focus on a patient's true health and well-being throughout the system, and hence the change in title and the change in scope.
Do you also have a CMIO, or as you said, that's sort of you with an expanded role?
At us, it's the CMIO with an expanded
Okay.
role. Although I think we're in the process of reevaluating: do we need someone that's truly focused on the medical practice, those types of things. So I would say for now, I'm wearing those, sort of an expanded role hat. but we'll see what lies ahead of us.
Okay, very good, excellent. All right, so today we're going to talk a little bit about EpicOps, which is going to be fun, and one of their products under there called Teamwork. But it's an interesting development of a suite. Lots and lots of sort of issues that I'd like to discuss around that. Um, but why don't you start by just talking about? So I guess a good place to start is before you're an Epic shop for a while, I would assume. You can give us some timing on that. Before Epic comes out with this teamwork concept, which is an enterprise resource planning suite, it sounds like this is interesting. We'll get into this too. Sounds like they're building it out slowly. There was a lot of wording in the press release they put out about aspirations and plans for the future and things like that. Some things are out, and certainly they have greater aspirations to build this out. So these are functions that theoretically had been going on in your Epic environment before Epic comes out with additional tools. I'd like to understand the evolution of your organization in terms of how you were carrying out these functions before. What was Epic? What was another vendor? Then Epic comes out with tools, and this happens all the time. We have to evaluate uh, are there benefits of going with the Epic tool based on its current maturity and capability versus what we currently have? What type of contracts are we in? All sorts of things there. I'll let you start and we can dig in, but if you want to take us a little bit through that evolution and how you came to be a user of a teamwork product.
Yeah. So this is a great question. The story behind our partnering with Epic to help develop teamwork is that we had an enterprise position scheduling nightmare inside our organization. We had contracted several years ago prior to my arrival with a large entity. I'm not going to name them. And we partnered with them to try to provide an enterprise-wide provider scheduling solution. It had a very strong adoption in certain departments, and other departments never adopted it. It was all over the map. And it was a good tool in terms of identifying, where, shifts that people needed to cover or roles that people needed to cover, putting people into those roles. It had some scheduling functionality that you could provide rules and it would generate your schedule. It did all those things well, but the integration wasn't super tight with them, right? And so we did have integration with Epic and it would exchange roles, but frequently we just weren't able to get things exactly right. And there was latency in the updates between the system.
Mm-hmm.
And so in the event you had to make a last minute change to something, you have a hospitalist that changed, that wouldn't be reflected in Epic for a period of time, 30 minutes during the day. Overnight, we actually had it turned off because no one was able to actually make a change to the frequently you had to have an administrator in the mix and they weren't available. So you had to change things in Epic and then change things in our paging system, which was separate. There just wasn't great integration. And because of that poor integration, certain departments were just said, there's no point. And the source of truth is actually going to be our operator scheduling platform, right? And so we had convoluted movement of information between our operators platform, our paging platform, our scheduling platform, and Epic. So there was really this opportunity in partnering with Epic when they announced that they wanted to develop this platform to fix a number of concerns that we had. And in doing so, Epic became the source of truth for who's available when, who's working, who's a patient responsible for a patient at any point in time. Additionally, because that became the source of truth, we were able to then attribute those things and say basically to departments, we have to have your schedules in Epic. right? We have to do this, right, for patient safety. And so, uh, we were able to move that entire platform to Epic's teamwork platform for schedule management. And that's been changing, a true change for the organization. So now when you go and you look for a patient and you're saying, oh, who's on call for this patient, you're going to get the right person,
Hmm.
right? And if it's not the right person, you're going to know very quickly, and then we can figure out who the right person needs to be, get it changed, and get it updated very quickly.
Hmm.
Um, and so that's been a huge change for the organization. So that's the first step in the EpicOps platform. They have a roadmap that goes forward to really cover, I would say, almost all of ERP. Um, and we're excited to be part of that journey with them as they continue to expand those modules.
Okay, very good. So you were not using like a workday, which is really sort of the product du jour of health systems going on. You see a lot of organizations, most have been on Epic for a while, right? I mean, now we're usually most systems have been on anywhere from 5 to 10 years. You still see some signing on now, but a lot of them are already on. But you do see quite a bit of workday going on, especially over the last 3 years. You used to see Lawson, and I think they were acquired, if my memory serves me correctly, they were acquired by Infor. So that was sort of the dominant play. Then Workday came in, especially with their cloud offering. You would see a number of Workday implementations alongside Epic implementations, which were sort of really heavy lifting, but some organizations decided to do both at once. This is a new model. I assume you weren't on any of those, were you?
No, and so regarding our time and attendance, we have a vendor there that we use for time and attendance, and then because we're a state entity and part of the university, our and under a single TIN, our payroll actually goes over to the university,
Okay.
and so we use the university platform over there to actually do payroll processing,
Uh-huh.
right? So we still have those modules that exist. Right now, this is exclusively physician scheduling, although we are looking forward to expanding it into other folks to create those schedules. For
Right.
now, time and attendance, because Epic's time and attendance module isn't available quite yet.
Right.
That will continue with our time and attendance platform. And we're going to continue working with our university, sort of back end ERP platform to actually complete payroll. But over time, we do anticipate that we're going to be seriously partnering with Epic to look at those tools that they're bringing forward. Everything from time and attendance to credentialing to potentially even that back end payroll. We'll be very interested to see what they develop over time.
Yeah, it's really fascinating. So you're in an interesting situation. I'm sure you're not totally unique, but you are not as a health system making completely independent decisions. There's the university overarching structure.
Yeah.
That's a major factor in what you can do and what you can't do.
Absolutely. And we get a lot of strengths from the university in our partners, in the way that they partner with us. They've been fantastic in the interactions we've had with them. It gives us huge capability in terms of storage and compute for our research and even our clinical missions. The ability for us to partner with experts in academia and bring them into the health system to help us solve problems. So all that's very powerful, in addition to the exchange of ideas and capabilities in the IT enterprise. But in doing those types of things, you do need to look for systems that can float all the boats
Hmm.
in the organization. You may not float as high
Right.
in certain areas as you would if you were able to go it alone. But I think overall the strength of our partnership outweighs the downsides in spades.
So you mentioned the challenges that you had in your previous iteration vendor landscape of what you were doing, and the integration frustrations, the batching, the time delays, and due to that, you had units that were saying, We're just not doing this. This isn't for us.
Right.
It's not working for us." So you had some in, some out. Now you have a setup. You're confident enough in to require adoption, right? There is no, it's not okay anymore because it totally makes sense. If you look at a system and to you, it looks frustrating. You're not going to hold people's feet to the fire to get on board because you're like, you
Right.
know what, you got a point. But now that's a different dynamic. Now it's no, this is pretty tight. You got to get on. Is that correct?
Absolutely. And we can make really it's a patient safety
Right.
concern, right? And so knowing who is taking care of a patient and who is your consultant is just pivotal, particularly in a large quaternary care academic medical center. We've got the sickest people in the state of Iowa that need really expert care 24/7, 365. And whenever there was a problem with finding somebody, that potentially could impact a patient's ultimate outcome. And not that it happened frequently, but when it did happen, it involved a whole bunch of people getting woken up at night to try to figure out, okay, who is actually responsible for this
Mm-hmm.
point in time, and how are we going to deal with these problems? And with the teamwork module, we just are not having that any longer. It's just very straightforward. And then I think over time, because of the ability to have the knowing who is doing what when, combined with that clinical data, over time is going to offer real opportunities for us to do better analysis, to come up with better staffing plans, to potentially to understand the workload that's being attributed to certain providers, make sure that we've got the right people and the right level of resources required for the care that we need to deliver. Just something we couldn't do before, because not only wasn't both sets of data in the same place, but there was distrust in the data, right?
Mm.
And so, and we knew there were the occasional flaws in the data. And so now that we really have something we can consider true, it makes it a lot easier for everyone to get around the table when we look at that data and agree that this is the truth. Now we need to make some hard decisions about how we're going to staff things and who's going to be accountable.
And that's the environment we need to create if we're going to leverage AI, right? Because if
Absolutely.
we want that analysis of supply chain, understanding, patient census, who's where, like you want it to eat all that and then give you actionable operational advice and say, hey, you need to increase supply of this thing because you've got all this going on, right? Because we need to create the environment where AI can go to work.
Absolutely. Having good data is the first thing you need in order to use these advanced analytic tools. And until we have good data, you're going to get garbage in, garbage out, right? And so this is really a huge focus of us is making sure that we get our data in a pristine format so that we can use it effectively with those AI tools.
Yeah, and we're really trying to match a very valuable supply, which is physician expertise, time, and knowledge, a very valuable and limited supply with an almost infinite demand.
Mhm.
Right? That's what we're trying to do, and we're saying we're not doing that well. Like in the previous iteration, we're not doing that well. We're leaving. I hate to use the term money on the table, but we're leaving patient care on the table unused because we have supply that sometimes goes unused, even though demand is through the roof because we're having this matching problem. We need to fix that.
That is absolutely true. And I think one of the nice things and we haven't talked about, our mission really was to fix this physician scheduling problem. So we knew who was provider scheduling problem. So we knew who was where when.
Hmm.
But one of the other things that comes with the teamwork module is actually a clinic room utilization. And so we've run a couple of pilots with that, and we're starting to move into using that as well to help understand our clinics much better and say, how much time are patients spending in rooms? How many patients is the provider be able to see? Is the provider not using those rooms wisely in terms of, or is there something that's created some type of slowdown in the system? So we think that room optimization is going to be a key component of us being able to take care of more patients in the very limited resources that we have from a brick and mortar perspective, right? There's only so much we can do in the virtual domain. You've got to bring patients physically to
Mm-hmm.
clinics at times.
Mm-hmm.
And so how do we actually optimize the use of that clinic space? That's so important. And people have had this concept around ORs for
Oh,
years,
yeah.
right?
Yeah. That's
That
why.
OR time is incredibly valuable. But your clinic space, because
Yeah.
it's so expensive to build today and so expensive to staff, right? Uh, uh, you know, Optimizing that clinic utilization is really important as well. And I think that's going to be a huge component of the teamwork module as well for delivering value to the organization here.
Great. Let's go back to the OR, and I'm laughing because I hear some inside baseball stories. My wife's a nurse practitioner, and I hear some inside baseball stories. You hear about surgeons who are always late, right? They're
Yeah,
always late. Now, I don't know if they're actually late for surgery or just the sort of pre and post appointments. But that you talk about the value of a surgical suite. If you have, you know what I mean? Usage, you want usage, you want it being used efficiently. I don't know. I'm sure there's numbers on every minute, every half hour chunk, every hour chunk. Like we have to figure out if there's a utilization, if this room is being utilized 90% and this room 60, like we have to dig in. We got to figure that out. And we may come to a root cause analysis of so and so's surgeon is always late. Well, we got to do something. We got to talk to him at least.
yeah, yeah. And I think that it's not just that people are late, people take vacation, people have emergencies, but definitely figuring out what that optimization is and how you optimize your surgical suite is really important. Um, we've partnered with a third party vendor to help us with that. But I'll be honest with you, I think a lot of this comes down to, and the analytics help in those
Mhm.
domains. But honestly, I think the number one thing with optimizing a surgical suite. I'm an anesthesiologist. I used to run a anesthesia platform at a large academic medical center before coming here. Um, the A lot of this is a mindset, right? And it's a teamwork mindset, and it's establishing what the goals are, making sure everyone's aware of that, and then putting the regulatory controls in place that are policy,
Mhm.
right? It's not necessarily the software that fixes these problems,
Mm.
right? It comes down to the fact that it's a 12-step program. The first step is acknowledging you have a problem,
Yeah.
right? And then implementing things along the way to do that. And much of that is regulating things. The technology can help us do that,
Yeah.
but unless you do those, acknowledge you have a problem and start saying things like, oh, people need to, we're going to monitor when people start their rooms on time. If they don't start their rooms on time, we're going to understand why. Now,
Right.
room starts is kind of a bad example because the amount of time you actually save in the day isn't all that great. But I only schedule half my OR block, right? Or this OR block always gets bumped because of an emergency case. And
Mm-hmm.
then we end up having to run ORs well into the night and pay overtime
Mm.
and have patients unhappy because they're being operated on at 9:30 at night and surgeons that are unhappy. Nobody wants to be doing an elective case starting at 9:30 at night and operating until 3 in the morning, right? So until we create an environment where everyone's accountable and everyone understands what the rules of engagement are, it gets very difficult to move that needle. The software can help us identify opportunities there, but really it comes down to the will of the people that are operating in that environment to
Mm-hmm.
change that environment and make things better. And that requires great leadership, and it can be facilitated by great software. And sometimes that software creates the pivot point, right? Oh, we're going to buy this software and that's going to help us change everything. But I sort of refer to that as Dumbo's magic feather,
Oh.
right? Yes, that software, because we installed this, it made us put all those regulatory controls in place
Mm-hmm.
and get us on thing. But guess what? If you took away that magic feather, Dumbo can still fly,
That's
right?
right. That's right. All right. Let's go into this a little bit. This idea of when you need to make a change. Again, we went through your situation prior to teamwork and engaging with the EpicOps concept. Um, There's a lot of dynamics there, and I'm wondering how governance plays a role in evaluating when there's a problem, when things are suboptimal, and alternative courses. It's a fascinating dynamic. It happens all the time. We'll just use Epic Shops as an example. Um, they'll be mostly Epic as much as possible. There'll be niche applications here and there for whatever reason. Perhaps they were there prior to the Epic implementation and they managed to stay around. Perhaps they were brought on after the Epic implementation for the reasons of functionality. Maybe Epic didn't have a product there. Maybe it's developing one. Maybe it wasn't ready yet. Then you have this dynamic over time of continually evaluating what we're using on the niche side, what Epic's doing, user satisfaction, total cost of ownership, cybersecurity, application rationalization. You need a meeting of the minds between users and IT and probably other elements because each side is going to bring different things to put on the scale. And if you just have the users putting their pieces on the scale, you may get one outcome. But once you bring in perhaps some of the considerations that IT has to make from an enterprise good point of view, this scale changes. So it's not purely user satisfaction there, and you know that sitting in the enterprise position. So governance usually works to work some of these things out. So that's just put that in your head. Now we talk about a lot of organizations being down this workday journey, which is probably a huge engagement, massive. Somewhere along that engagement, perhaps fully implemented, looking at it, or in between. Having to make these same decisions, seeing Epic now over here start to create, and probably some CIOs going, good Lord, I thought I had everything worked out and simple. I was going with Workday. Life was good. And now we got this. Now I've got to do the same evaluation we do all over the place about do we move? Do we stay? Where am I in my contract? What kind of sunk costs do we have? Anyway, I'll stop there and your overall thoughts on that dynamic.
Yeah, so I think you brought up a number of good points there. I think the first thing is Epic first. You hear a lot of people say that they're an Epic first shop. I think really the way to be thinking about this is, are you Epic smart, right? And so that's our vernacular here, which we definitely look at the Epic solutions, and when they're ready, right? And when we're ready, it's the right time to go to Epic for that given solution. With this module, we saw the benefit of that integration being so strong that even though the product wasn't, we really signed up with Epic to help as an early adopter to help, and with that help develop the product. But we saw the benefits being so profound that making that move early made a lot of sense. I think in terms of your overall approach to ERP, I think it's a very difficult time right now. Clearly, Epic's not there, right? Their product pipeline is coming on fast for these sets of products, but they don't have everything soup to nuts that you can lift and shift from Workday today or whatever your ERP platform is. But I think it's something you got to have on your radar long term. And I think the real thing to be thinking about, and the way we're thinking about this, is what's going to be the advantage of having not just potentially the pricing benefits that might come along with this, but the data benefits of having all of your clinical data aligned to your ERP data, right? What is that going to enable you to do from an analysis perspective in terms of total costs of care delivery and care optimization that you can't do today? Because to get everything out of Workday, extract that, and meld that with my clinical data is very, very difficult. And so I want to know how many nurses touched this particular patient and how much time they spent with them and what the total cost of that nursing workload was on this particular type of patient that flows through my system. That analysis, just getting the data all in one place today, is a monumental challenge for your analytics team. Well, with all the data being in one place, a huge part of that challenge has just been evaporated, right? And when you put a layer of AI on top of doing that analysis, understanding that and knowing what that schema looks like of your reporting data sets, of your reporting databases, that's going to enable us to ask and answer some very interesting questions going forward that I think will help us develop much better appreciation for actually the total cost of care regarding certain diagnoses that come into the health system, in addition to optimizing the care that we deliver, and finding ways to potentially reduce that total cost of care. Questions about ambulation, questions about testing, associated testing with various procedures, things that just very difficult for us to understand the total cost today, I think is going to become very clear to us when we get all of this data in one place.
Yeah. And this probably isn't a question for you. It's probably more of a CTO or a CIO question is, if we continue to consolidate, do we create a risk that we at least need to be aware of, right? If we go, right, we're all on one. We used to have three, four vendors from our major platforms. All of a sudden now we have one vendor for a major platform. Well, that works great if we're getting good customer service and we're happy and all that kind of thing. Um, if things aren't going in that direction, it can be a little troubling. I don't know. You have any thoughts about that?
I think it's a very good question. I would point to many other businesses that exist today, though, outside of the healthcare enterprise, and many of them have focused on: am I a partner of Microsoft or am I a partner of Google?
Mm-hmm.
Right?
Mm-hmm.
In terms of my business applications, right? That's it's probably 80% of the market is consumed by those two entities. And yeah, or if Azure's having a bad day, right?
Right.
Your organization's going to have a bad day, right?
Right. Right.
But I think we're moving away more and more from point solutions to platforms, and
Yeah.
I think the next natural thing in the evolution is going to be is, can you consolidate those platforms? Right? Look at AI right now. Is it really in your interest to end up having contracts with Anthropic, Google regarding their AI, AWS, and OpenAI and Microsoft? Right? Is that really what you want to be doing? We're doing it because each of them is bringing unique solutions. But if you could focus on one platform that could do the vast majority of your work, I think people would prefer to settle on one platform if they can. But is there risk in being on one platform? Absolutely. Like I
Yeah.
said, if GCP, AWS, whoever your cloud vendor is having a bad day, things are going to slow down at your enterprise. There's no doubt.
Right. And I guess the core issue that we're in this paradigm is because integration never got or hasn't gotten to a plug and play scenario. You have a vacuum cleaner, you go anywhere, plug it in this country, plug it in any outlet, right? Doesn't matter, works. We never got that way with healthcare data exchange where you can, send a record. You can't even do it within one vendor product because there's different iterations, different instances, let alone cross vendors sending, a patient record from an Oracle shop to an Epic shop and having it flow seamlessly in to
Yeah.
the like. We're not there. That's why we have the integration problems that you discussed earlier. And that's why we want to consolidate, is because integration just at this moment in time is not the answer.
Well, and I think that's profoundly true. I mean, I think regarding the fundamental data, we've got a lot of that down, right? Between HIEs and uh, and internal exchange, particularly if you're Epic to Epic shops. But when you want to bring tech into the picture, right? Like, I want my novel application to be able to write orders in Epic. I can't do that, right? And to make that application really strong, I needed to be able to create orders seamlessly, right? And they just can't.
Hmm.
And so, and so there's all types of workarounds and cajoling and things like that that people are trying to make that possible. But there's just, unless you have access to the operating system, like in Microsoft, like with Windows, right? I can basically create an application that can do anything in Windows because it's got really strong APIs enabling me to do almost anything to the system. Unless you have that capability, the primary vendor, whether it's Oracle Health or Epic or Allscripts or whoever it is going to have that native advantage. And so consolidating to that platform is just going to make a lot more sense. And I think that's just the world in which we live. I don't see that changing anytime in the near future, that we really have full open APIs to these EHRs. And potentially for good reason, just due to the risk of rogue applications, going into your. Can you imagine, someone writes an application in Epic and they make a mistake and they corrupt your entire, employee file or something like that? You can't have that happen. And so how do you create that safe environment? That took decades for that to happen with iOS and Windows. It's going to take. Even if Epic and Oracle started on that today to create that, we'd be, a decade out from having that type of capability.
All right, great. I'm going to let you go soon. Let's just make this sort of a final question type thing. A lot of what IT executives have to manage and deal with are new application requests from users, right? A physician, surgeon, anyone was at a trade show or a vendor managed to get in front of them. They get really excited about an application. They love it. It looks fantastic. They get a demo, whatever. It gets over to IT. Hey, we want this. IT's got to evaluate, see if we have it, if we already have this capability, figure this stuff out, and probably communicate back at some point what might be integration challenges. So you love this application, but if we go down this road, you're going to have these limitations. And you just described some of them. What would be your advice to IT executives? But sometimes it's worth it, right? Sometimes it is worth it. So what would your advice be to IT executives on managing the dynamics of those discussions?
Start with finding the problem that you're trying to solve. That's where you need to start, and put the solution aside. Understand the problem, and can you solve that problem with the tools you already have? Right. Sometimes you need a specialized tool, right? But much of the time, I think you can solve the problem that exists with tools that are already in your armamentarium. And then, if you need to purchase a specialized tool, look for something that can be extended and become a platform, right? And so rather than finding those point solutions, say, this is a novel problem, but it exists actually not just in cardiology, it exists in ophthalmology and radiology and other things in an imaging platform. So how can we expand our imaging platform portfolio to have a tool that extends across the enterprise and addresses all of those concerns? I think that's really the thing to do, is if you start with the problem, understanding the problem, and then look for platform solutions, it helps reduce your total spend and actually create that integration that you want as a leader to help reduce the costs and maintain a high quality of service that you can't do with a bunch of point solutions.
Dr. Blum, this has been excellent. We're about out of time. I really, really appreciate your time today, and I hope we can catch up with you again down the road. So thank you very much.
Anthony, it was a pleasure. Thank you.
Have a great day.
You too.